Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Now we'll be looking at the treatment of asthma. So first, the type of category, it's going to be the short-acting, and this will be nothing but the beta-2 agonist. The short-acting beta-2 agonist, so the time period here is about 4 to 5 hours. The drugs, it includes the salbutamol and the terbutarin. The bronchodilators that relax the bronchial smooth muscles. They relax the bronchial smooth muscles and have a rapid onset of action. So uses of the short-acting beta-2 agonist is that there is salbutamol. So salbutamol. So salbutamol can be used to treat the hyperkalemia. By the nebulization. Next is, what is the adverse effects of this? The adverse effects of these drugs, short-acting beta-2 agonist, it includes hyperglycemia. So it can lead to hypoglycemia and also the hypokalemia. So hypoglycemia and hypokalemia can be a side effect. Then we move on to the longer-acting beta-2 agonist. Longer-acting beta-2 agonist is nothing but it includes 12 hours, and the drugs is nothing but the drugs are the formoterol. So formoterol is a drug. Next, there is also the presence of the fast onset drugs of formoterol is a fast onset. Then comes salmeterol. S for slow. So it is salmeterol is slow onset. Then comes the other bronchodilators that relax the bronchial bronchial smooth muscles, and have a gradual onset and sustained activity. Now looking at the uses and side effects. Uses and side effects of the longer acting beta-2 agonist. They are nothing but these drugs are always used in combination. They are used in combination with the inhaled corticosteroids. So they are used in combination with the inhaled corticosteroids. Then we move on to the short-acting muscarinic. Short-acting muscarinic and the longer-acting muscarinic antagonist. So here the drugs, it includes the ipratropium bromide and also the other drugs such as the tiotropium bromide, the glycopyrronium bromide and the umeclidinium bromide. So the bronchodilator, but it is less effective. There is bronchodilators, but it is less effective than the beta-2 agonist. And next is the asthma therapy, because it inhibits only the cholinergic reflex component. So it inhibits only the cholinergic reflex component and of the bronchoconstriction. And next is whereas the beta-2 agonist prevents all bronchoconstriction mechanisms. So beta-2 prevents all constrictor mechanisms. Now let's move on to the uses and side effects. So in terms of the longer acting beta-2 agonist, the uses and side effects is that these drugs are always used in combination with the inhaled corticosteroids. So this is what we discussed earlier. There is a longer acting beta-2 agonist. Now moving on to the short acting muscarinic agonist and long acting muscarinic agonist. So here the uses and side effects is that the SAMA is used mainly for the management of the COPD, then the bronchial asthma. And what are the adverse effects? The adverse effects is nothing but it is bitter taste. Bitter taste is the adverse effect, and also the paradoxical bronchoconstriction. The next is LAMA. So LAMA is used mainly in the management of the COPD, but advantage is no paradoxical bronchoconstriction. So the adverse effects previously was the bitter taste and paradoxical bronchoconstriction. In terms of LAMA, it includes the LAMA is used mainly in the management of the COPD, but advantage. So advantage is no paradoxical bronchoconstriction. So there is no paradoxical bronchoconstriction. And what is the adverse effects? The adverse effect is that there is presence of dry mouth, as well as there can be urinary retention. To learn and grow daily like this, please do subscribe.